Bonjour tout le monde, est-ce que vous m'entendez? Bonjour, je suis très heureuse d'introduire cette conférence plénière. Mon nom est Marion Leboyer, je suis professeure de psychiatrie à l'université Paris-Est-Créteil. Très heureuse d'être là aujourd'hui et encore plus heureuse de vous présenter le professeur Joseph Zohar qui est venu spécialement d'Israël pour faire cette présentation et que je vais brièvement introduire avant bien sûr de lui laisser la parole. Joseph Zohar a fait ses études de médecine à l'université Tel-Aviv. Il a été formé à la recherche au NIMH où il a travaillé sur les mécanismes physiopathologiques qui sous-tendent le TOC avant de devenir un grand spécialiste du traitement préventif du stress post-traumatique pour lequel d'ailleurs il a fait une conférence il n'y a pas très longtemps aussi au Palais des Congrès Porte-Maillot. Il a été le président de l'ECNP, European College of Neuropsychopharmacologie. Et en tant que vice-président, il dirige maintenant le projet qu'il va vous présenter aujourd'hui, qui est le projet de développement d'un programme dévolu au développement d'applications qui permettent d'améliorer la prescription des psychotropes. Et cette application que nous avons traduite en français, c'est ce qu'on va vous montrer aujourd'hui, on l'a traduite conjointement avec un soutien de la Fondation fondamentale, de la Fondation de Necker et de la FPBN, permet que nous, en France, nous ayons aussi accès à cette application. Et je laisse le professeur Zohar venir vous la présenter. Many thanks.
Thank you very much, Marion. Sorry that I cannot talk in French. If you can put the first slide on. Yeah, okay. So I'm going to talk about neuroscience-based nomenclature, and this is my conflict of interest, nothing to do with this presentation. Let me start with the presentation by giving you a short clip in French.
NBN2. La nomenclature basée sur les neurosciences mises à jour est le fruit d'une collaboration inédite entre 5 grandes organisations scientifiques internationales possédant une expertise en psychopharmacologie et est reconnue par les plus grandes revues scientifiques. NBN2 reflète les connaissances contemporaines. NBN2 propose de passer de l'ancienne terminologie à une nouvelle terminologie. Elle fournit un système de nomenclature pharmacologique qui aide les cliniciens à faire des choix éclairés. NBN2 diminue la stigmatisation en remplaçant l'ancienne nomenclature basée sur la maladie. Au lieu de donner des antidépresseurs pour les troubles de l'anxiété, nous parlons de se concentrer sur le système sérotoninergique pour traiter les troubles de l'anxiété, de justifier le choix du médicament spécifique et donc d'améliorer l'adhésion du patient. Pour les cliniciens et les chercheurs, l'application NBN2 est un outil simple mais puissant. Comment ça marche? Commencez votre recherche en tapant dans la zone bleue. Par exemple, tapez dépression pour trouver quels médicaments sont utiles dans le traitement de la dépression. Une fois que vous avez tapé votre mot-clé, tous les médicaments pertinents s'afficheront. Pour savoir lesquels de ces médicaments fonctionnent via le système noradrénergique, ajoutez simplement un axe de recherche pharmacologie et tapez noradrénaline. Tous les médicaments efficaces contre la dépression et agissant via le système noradrénergique sont maintenant listés. Si votre patient se plaint également de douleur, vous pouvez pousser la recherche plus en profondeur en ajoutant un autre axe, efficacité et effets secondaires. Tapez douleur et les options de médicaments qui correspondent à ce profil vous seront présentées. Cliquons sur nortriptyline. Vous pouvez maintenant voir sa classification NBN2, c'est-à-dire sa pharmacologie et son mode d'action, et aussi avoir accès à des données importantes et pertinentes telles que les indications approuvées, les effets secondaires, son efficacité, les notes pratiques, la neurobiologie et même sa structure moléculaire. Une autre fonctionnalité intéressante est la possibilité de voir des médicaments similaires. En balayant l'écran vers la gauche, vous pouvez voir d'autres médicaments identiques dans leur pharmacologie et leur mode d'action. Faire la comparaison entre des médicaments similaires peut vous aider à faire une prescription rationnelle. Restez à jour. Téléchargez la nouvelle application NBN2. De nouvelles connaissances, une nouvelle nomenclature.
It's not my next slide. Okay, so we are going to talk about nomenclature. Nomenclature is basically choosing name for things. And the current nomenclature that we are using is disease-based, indication-based. We are talking about when we talk with our patient, when we talk ourselves, when we think. We talk about antidepressant, antipsychotic, anxiolytic, hypnotic, mood stabilizer, stimulants. This is basically the language, the vocabulary that we are using. And this disease-based nomenclature is confusing for the patient. Many times we prescribe so-called antidepressant for anxiety or so-called second-generation antipsychotic for depressed patient who show no evidence of psychosis. I'm sure that you encountered the situation when the patient is telling you, why are you giving me antidepressant for my anxiety? So it is confusing. It must be confusing for the patient to find out that the anxiety is being treated with antidepressant. And think about the depressed patient that you are prescribing to him second-generation antipsychotic. The patient might ask, is my condition so bad that you are giving me antipsychotic? It is horrifying to find that your depression, the depression is being treated with antipsychotic. And of course, this has an implication on the adherence. If the patient or the family does not understand why they are getting antidepressants for anxiety or antipsychotic for depression, it must have an implication on the adherence, on the compliance, on taking the medication. Moreover, the disease-based nomenclature is confusing for us as well. Let's say when we need to choose between first and second generation, so we can look at sulpiride or amisulpiride. One is first and the second is second generation. And if you look at the pharmacology and mode of action, they are exactly the same. How is nomenclature in other fields in medicine? If we look, let's say, at our colleagues who treat hypertension, their nomenclature is based on mechanism. And when they talk about the medication, our colleagues who treat hypertension, they talk about diuretics, beta receptor blocker, calcium antagonist, AC inhibitor, angiotensin, and so on. And basically, the nomenclature, the name that they gave to medication, is a tool which helps them to make informed decision. Let's say while they are thinking about augmentation, adding another medication, they would choose medication that affect different mechanisms. And the way they choose it is based on the name that they gave to the medication. So does it help us, the current disease-based nomenclature, to make rational decision, evidence-based decision while we are thinking about our next pharmacological step? Let's take the example of antipsychotic. Does the term antipsychotic actually help us to make informed choices? we refer to first generation and second generation. What is second generation? We can think about second generation smartphone, or now 5 or 4th generation, or 5th generation, or second generation car. Second generation is marketing. It's not helping us to make any informed decision. Let's think about it, whether it helps us or not, this term second generation, to make informed. And going back to the point about nomenclature. Nomenclature is about creation of categories of like things. And if we think, let's say, about amisulpiride and aripiprazole. Amisulpiride is receptor antagonist, T2 antagonist. Aripiprazole is receptor partial agonist, T2 5-HT1A. Are they really alike? Are amisulpiride and aripiprazole really like things? They are, of course, not. They are very different. So in this regard, the current disease-based nomenclature is not helping us in this regard. Another problem, the existing nomenclature doesn't reflect the current scientific knowledge. We talk about antidepressant, antipsychotic, and so on, and we don't introduce there the monoamine hypothesis. We are very proud that 3 psychiatrists got the Nobel Prize for working out how the monoamine system explain how psychiatric drugs functioning in the brain. And basically, Ari Carlson, Greengard, and Kendall got the Nobel Prize for the work how the monoamine system and psychiatric drugs functioning in the brain. There is nothing there in the current nomenclature. Actually, the official WHO current nomenclature is talking about psychoanalytics and psycholeptics. Of course, we don't use these terms anymore. And what is interesting is that the current nomenclature is actually 60 years old. The nomenclature that we are using is 60 years old, and it needs to be updated. And if we think about it, in psychiatry, we do a lot of updates. We update the diagnostic system, moving from DSM-4 to DSM-5, ICD-10 to ICD-11, and so on. We keep updating the diagnostic system based on the knowledge. This is not the case for our nomenclature, for our classification, for the naming of psychiatric medication. So it has become clear that the current disease-based nomenclature does not reflect contemporary knowledge, nor does it inform the clinician about rational neuroscience-based prescribing. And for this, there was a task force that was established, including 5 international organizations with expertise in neuropsychopharmacology, the ECNP, the European College, the American College, the ASEAN College, and the International College, and the IUPHAR, the International Union of Basic and Clinical Pharmacology. These 5 organizations, and this is the task force that composed them, 2 individuals from each organization, Stephen Stahl, Hans-Jürgen Moller, Pierre Blier, David Cooper, Yamawaki, Ushida, Drago, Guy Goodwin, and David Nutt. All of these started this initiative. The mission was to come up with nomenclature that help clinicians to make informed choice when they are trying to figure out what would be the next pharmacological step. And to decrease the stigma and enhance adherence by naming system that lays out the rationale for selecting specific medication. All the expenses were paid by ECNP. There was no any direct or indirect support from any pharmaceutical company. The proposal was to focus on pharmacology. So it is pharmacologically driven nomenclature. It's not anymore indication-based, not anymore disease-based. So focus on pharmacologically driven nomenclature that include the contemporary neuroscience understanding of how medication work. And the idea is that pharmacology or psychopharmacology provided good starting point for mechanistic understanding of psychiatric disorder, as opposed to diagnosis, the indication which remains quite arbitrary. So basically, this includes two steps. One is pharmacology, and in the pharmacology, we include all the pharmacological domain that each time that we are prescribing medication, we are tapping on. Any ideas how many pharmacological domain we got in psychiatry? Any idea from the audience? How many think that it's more than 50? How many think that it's 10? Okay. So basically, you're right. I mean, there are 10 pharmacological domains. And each time that we are prescribing any medication, we're tapping upon acetylcholine, dopamine, GABA, glutamate, histamine, orexin, melatonin, or epinephrine, or opioid, or serotonin. So basically, each time that we are prescribing medication, we need to think to ourselves, what is the pharmacological domain that we are going to tap upon? And then the next part is the mode of action. How many modes of action we got in psychiatry now? How many? 3. Other people? What do you think? 5. Okay, you're getting better, but actually we got 9. So each time that we are prescribing any type of medication, we touch upon this 10 pharmacological domain and 9 mode of action. Receptor agonist, partial agonist, antagonist, reuptake inhibitor, releaser, enzyme inhibitor, ion channel blocker, PAM, or enzyme modulator. So each time that we are prescribing any medication, we need to think what pharmacological domain we are tapping upon and what is the mode of action that we are going to operate. How many psychotropics we got all over? Any feeling? More than 100, less than 100? More than 200? How many would vote for more than 200? 150, basically. So basically, if we look at all the medication worldwide, it's about 150. So basically, the nomenclature and the mode of action help to expand our vocabulary. We don't use any more vocabulary that consists of these 9. We use different words, more concept to talk about the medication that we are using. The Inuits, for them, survival in the snow is extremely important. So they use 50 different words to describe the snow because it's important for the survival. I think we need to expand our vocabulary to make sure that we use the right word and we choose the right tools while we are prescribing any medication. So based on neuroscience-based nomenclature, based on pharmacology and mode of action, how many different group of drugs you think we got? How many tools we got each time that we prescribing medication? 10? 50? 100? How many think that we got 10 different tools? How many think that we got 50? 100? So basically, we got 60 different tools. If we think about the pharmacology and mode of action, based on this, we got 60 different group of drugs to work with. And each time that we are seeing a patient, we need to choose the best fit out of the 60 different tools for the patient that we are seeing. And for this, we got some product that might help. We got a book that is available, and we got book, and we got also something specific for child and adolescent. So basically applying the same concept of neuroscience-based nomenclature for child and adolescent. And we got an app, and we are going to talk about it, that help you to select, to search the right medication. Where do we stand now? If we look about the number of psychiatrists that download it, it's more than 80,000. How many here download NBN? How many here got NBN? So I think there is some room for improvement, and we can increase the number, which is keep going up, hopefully after this meeting where it's going to keep moving on. And at this point, we got more than 80,000. It is part of the textbook of Oxford Textbook of Psychiatry. It is in the next edition of Tasman Psychiatric textbook. It is in Brazilian Textbook of Psychiatry. It's going to be in the next edition of Kaplan and Shaddock. And it's part of Stephen Stahl Prescribing Guide. It is part of David Nutt book, and will be part of the Mostly Prescribing Guide next book. We got also acknowledgement or position statement of the American Psychiatric Association, and basically in their position statement, they talk about what is unique about NBN, talk about patient acceptance, going back to why I'm getting antidepressant if I'm not depressed issue. They talk about harmonization of psychiatry with other specialty, i.e. referring to specific mechanism of action rather than indication-based. They talk about avoidance of non-specific terminology such as major and minor tranquilizer or second-generation antipsychotic. And this is important. They talk about NBN as a teaching tool. that present the depth and richness of neuroscience fabric of psychotropic, and expanding the psychiatric toolbox that we talk about by presenting 60 different types of pharmacological tools. So how you can join, how you can be part of this? As I mentioned, there is the NBN app, and you can download it. It's free, and I encourage you to download it now. Since we are going to look how it actually works, so you can download NBN 2. And in the NBN, what is included is the pharmacology and mode of action. And then we got 4 additional dimensions that would help you to make more useful. Approved indication, efficacy and side effects, practical notes, and neurobiology. Approved indication is basically recommendation of major regulatory bodies, the FDA, the EMA, etc. In the efficacy and side effect, we highlight the situation where the compound fell short of approval for formal indication, although there is evidence to support its use. In the side effect part, only prevalent or life-threatening effects were included. In the practical note, we summarize the clinical knowledge of the task force. And in the neurobiology part, we include the empirical data, and we got also pregnancy layer, in which you can look for the safety of using the medication during pregnancy. So basically, when you use the app, what you learn is you learn about the pharmacology, the mode of action, the indication, the efficacy and side effect, practical note, and neurobiology. So we got the NBN2 app, and we got also the child and adolescents. Let me show you a short clip about this. This time is still in English, but we try to make it in French too. No, I think it started. We'll move back a little. Yep. We don't have the sound. Okay, we'll skip it.
Clinical pearls regarding specific side effects, safety and dosages in this age group. How does it work? Let us say that you see a child with ADHD. When typing ADHD on the purple area, you get a list of the relevant medications. In this case, the complaints are also on aggressive behavior. So touch Add Search Axis, then touch Efficacy and Side Effects, and type Aggressive Behavior. The results will show medications that work for ADHD and aggressive behavior. Looking at the child, you observe that he also has tics, so you touch again on Add Search Axis and Efficacy and type in tics. By the end of this intuitive process, you zero down on the medications that work for ADHD with aggressive behavior in children who also have tics. Let's go with haloperidol, and you can see its NBNCA classification, that is, its pharmacology and mode of action, as well as access to important relevant data such as approved indication, side effects, efficacy, age-related practical notes, and neurobiology. Another cool feature is swipe for similar drugs. At the top of the screen, you see small circles. These indicate that there are similar medications which you can explore by swiping to the left. This feature helps you find and compare different medications with the same pharmacology and mode of action, and to be more precise when prescribing for your patient. Use technology. Stay updated. Get NBN2 and NBNCA app. New knowledge, new nomenclature, new technology.
Okay, so now we are going to see how it actually works, and I'll encourage you to look at the app while I'm doing this on the screen too. So basically, while you open the app, what you see, you get the primary search area, the blue, and you get secondary search, black area. And then you got these 6 buttons: name, pharmacological target, mode of action, approved indication, efficacy and side effect, and former terminology. So you start by typing your search in the blue area. Let's say type your search. So let's say that you are seeing a patient who is depressed, and you give him serotonergic medication, and the patient got sexual side effect, and he doesn't want to take the medication because of the sexual side effect. So you are trying to figure out what should be the next pharmacological step. So basically what we do, we type depression on the blue area. And you can do it on your app. And then you get all the medications that work for depression. But as you remember, this particular patient, because of the serotonergic side effect, doesn't want to take the medication. So you'd like to find medication that work for depression via noradrenergic system. So what you do, you type on the black area norepinephrine, and now what you got, medications that work in depression via noradrenergic system, and you get the entire list here. But as you remember, the issue of this patient was sexual side effect. So you again going on to the black area, and then you type on the black sexual side effect. So basically now what you got is search for depression that work via noradrenergic system and have low sexual side dysfunction. And here you got all the medication that fit into this. So basically, now what we see, after we add this, we get all the medication that work in depression. You get all the medications that work for depression via the noradrenergic system and have low side effect, and you see the list of the medication. Let's say you decide to choose one medication, you choose reboxetine. So what you see on the pharmacological target, that it's norepinephrine, it's reuptake inhibitor, it's indicated in major depressive disorder. In the practical note, you see that it got low probability of sexual dysfunction. And now what you can do also, you can look at the right upper part, and then you discover sweep to the left, which basically, while you are doing so, you can see if you're doing the sweep to the left, different medication with similar pharmacology. So basically, while you are doing so, you're doing the different medication, and then you can look at other medication and find how it fits with the specific profile of your patient. One important part of this is also the part on the upper left side. And if you do this, you get, what I talk about, the mode of action and the medication that we are using and so on. What is very important for us in this, and here you can get also the language, and you can choose if you like to do it in English or in French. What is very important for us is this part, send feedback. We know that what we got is not perfect and we need to improve it, and we welcome any feedback. So this is basically the point about the medication. You can use it offline and online, and you can use the airplane mode to restart. As I mentioned, this is work that has been done by many, and my collaborators on this are Stephen Stahl, Hans-Jürgen Moller, Pierre Blier, David Cooper, Shigeto Yamoaki, Yoshida, Filippo Drago, Guy Goodwin, and David Nutt. I encourage you to download it and to use it and send us feedback about this. Thank you. Okay. I guess there is no place for a question, but thank you, Marion, for initiating this.